New report recommends a larger role for the CDC in cannabis public health policy, Dr. T. That's right. A federal advisory panel is recommending the Centers for Disease Control and Prevention to take a larger role in policymaking around cannabis as its use among Americans continue to grow. A report issued Thursday by the National Academies of Sciences, Engineering, and Medicine outlines several recommendations for the CDC regarding how the agency can get more involved. The panel is also pressing Congress to change the definition of hemp, which produces THC, an intoxicating chemical, so that it can be regulated, thus closing the loophole that allows certain products to be sold even when cannabis use is illegal in the region. In quote, there is an urgent need for a coordinated public health approach to cannabis policy in the U.S., Dr. Stephen Tuchich, a senior fellow at the University of Southern California, wrote in a release. In a quote, our report shows that the cannabis policy often focuses on regulating sales and revenue first and protecting public health second. Now is the time for the federal government to create guidance for states that have legalized cannabis in the interest of protecting the public's health, Tooch, who chaired the committee, added. NASEM also urged the CDC to create a public campaign targeting parents and others to teach them about the risk of cannabis and discourage unhealthy use of it. According to the report, the panel also recommended that the agency create a public health surveillance system to monitor the impact of cannabis on public health and track sales of products. That sounds scary, but whatever. The report was sponsored by the National Institutes of Health and the CDC, and their findings come as daily or near daily marijuana use is overtaking the daily use of alcohol. THC levels in products have also spiked per the report. That's right, around 17.7 million people in 2022 said they use marijuana daily or nearly daily. An analysis published in late May revealed currently 38 states and the District of Columbia allow for the use of cannabis for medical purposes, according to the CDC. The advisory panel said regulators on the state level should mandate certification and training for workers who deal with customers at cannabis retail stores, and NASEM also recommends states that have already legalized or decriminalized cannabis seal or expunge records for low-level cannabis-related offenses. Cannabis use has been seen as a treatment to ease chronic pain, but the risks for heavy users can include car accidents. I'm not sure about that after Dr. T's last story, and repeated bouts of vomiting, we've seen that can send people to the emergency room, the Associated Press reported. The report comes as the Biden administration made moves earlier this year to reschedule marijuana from a Schedule 1 designation to a Schedule 3, and the change will likely soften penalties around its use. I'm not too sure about that, but and they say complete decriminalization of marijuana could be accomplished through Congress with legislation removing the drug from the Controlled Substances Act, and there's going to be a whole bunch of activists out there in Virginia on December 2nd, so make sure you check out what they're going to be doing too. But I can't wait to hear what you guys have to say about this. Crickets?
You're going to have to wait because we're not saying anything, are we?
You're not.
I agree with the surveillance. I just don't like when they make laws without evidence.
Mm-hmm.
Maybe it's the scientist in me. And so there's all these assumptions like high THC is bad for you. There's no proof that high THC is bad for you. They're using correlations that are not showing causative. And so let's back off. Let's watch people use high THC and see what happens. Mm-hmm. And the other one that I don't like is judging potency just based on THC. We all know that potency is more, that the plant is more than THC. It's THC, at least THC and CBD are doing a dance together in the plants. And there are 3 types of cannabis: type 1, type 2, type 3, regulate it that way. If you don't want people using type 1, then call it what it is, type 1, which is a ratio of THC to CBD, not just a level like 0.03% or whatever it is that they're using.
Yeah. Very, very, very well. Very well. Man. Any thoughts on this, Matthew?
I really disagree with the doctor on this, and would dial in even more so to the plant should just be descheduled and freed up.
Mm-hmm.
This is like, use broccoli, But cauliflower can't be sold at the broccoli store. You can only get cauliflower at Target. And then broccolini, you can only get that at very small Italian mom and pop grocers. You know, it's just ridiculous. It's a plant. And I'd like to see more and more people using the plant for more purposes. Really, when we get to hemp, I just want to keep kicking people in the ass, man. We need hemp for food, hemp for fiber, for fuel. We need hemp bioplastics that are compostable and non-toxic and that don't leach synthetic estrogen into our water and food. Because they're turning the frogs gay, Jason. They're turning the goddamn frogs gay.
Hemp,
Oh, boy.
Hemp for the people, Mathieu St. Germain.
Little Alex
Hemp
Jones for
the
you,
people.
Brother Beck. This beautiful Friday.
I saw what you did there. I did.
Free the broccoli.